Hello, I'm Dr. Giavonne Rondo, host of Healthy Mind, Body, and Spirit, a show that's focused on the wellness of our entire world, but with a particular focus on the African American community here locally. We talk about a plethora of different topics that specifically focus for our community: high blood pressure, diabetes, asthma, congestive heart failure, lots of different topics, including COVID-19. Today's topic is going to focus on something that we talk about a lot in our community: high blood pressure, also called hypertension. We have a wonderful community cardiologist that is, I'm just so excited to have him here today, Dr. Juan Ortiz.
Thank you.
Welcome, Dr. Ortiz.
Thank you, doctor.
So tell us just about yourself, the field of cardiology, and just what you see during your day.
I'm a practicing cardiologist at Clark Memorial Hospital in Jeffersonville, Indiana.
Okay.
Been in Louisville area for about 20 years now.
Oh, wow.
And we've seen cardiology evolve over time, seeing different disease processes evolve over time. Some getting better, thank goodness, over time. But still, there's a lot of disease out there that we should address, as you said earlier, off camera, upstream, like hypertension, like diabetes, like chronic kidney disease. Things that we can address upstream will help the patients avoid the downstream consequences, such as congestive heart failure.
So when you talk about upstream, you're just basically talking about prevention, preventing us from actually having other medical conditions overall. So
yes, ma'am.
Yeah, so that's very important. So one of the things that we see a lot in our community, in the African American community, that we talk about a lot, is high blood pressure. Can you just tell us in detail? I know a lot of us know about it, but just in detail, what is high blood pressure, or what is hypertension, and also congestive heart failure?
Hypertension, actually the diagnosis and the descriptor of hypertension has evolved over time. When I was in school, high blood pressure, 150 systolic was accepted, and then 140. And now the appropriate blood pressure is 130 for the top number and 80 for the bottom number.
Okay, so when you mention systolic, you're talking about the top number.
Top number.
And then
the bottom number, 80. In
Okay.
training, it was 140 over 90, but they realized that that blood pressure is still too high. So now the optimal blood pressure is 130 over 80. It's appropriate to also think that you can't go too low for some of the older people in our communities, because they find that driving a blood pressure too low causes other consequences, such as low enough blood pressure to cause fainting and falling. So they accept a little bit higher blood pressure in the older American. But 130 over 80 should be our goal for most patients.
Okay, so you would say like a younger population, like adults between the ages of maybe 18 to maybe 60-ish or 70-ish, should have readings about 130 over 80.
130 over 80.
Okay.
You take a blood pressure reading, you don't accept just one reading. You see your doctor on a regular basis, and you take your regular blood pressure readings. If you have an elevation that's a one-time elevation, not a big consequence. But if it's constantly high, if your diastolic bottom number is always in 90s and 100s, you're setting a problem for the future.
Okay, okay. So just having high blood pressure, it's one thing. But what about the consequences? Can you talk a little bit about that, the consequences of having high blood pressure, particularly when it comes to congestive heart failure?
Hypertension is a leading cause of congestive heart failure. Congestive heart failure is the heart can't do its pumping job very efficiently. There's different forms of congestive heart failure and different causes, but the main cause in the African American community is hypertension. It's interesting that heart damage in African Americans related to high blood pressure, and heart damage related to the white population really is coronary artery disease. So you have two different spectrum already, some division in the pathophysiology or the process of hypertension and its consequences.
Oh, wow. Okay, I didn't know that. So, okay. So in terms of, can you tell us what to look for when it comes to congestive heart failure then, since that is something that can occur from having high blood pressure?
Congestive heart failure is an umbrella term. The most common presentation for people with congestive heart failure is shortness of breath and shortness of breath on exertion. But we also find people that have edema or swelling of their lower extremities, sometimes edema of the abdomen, depending on what part of the heart isn't doing its job as effectively as it should.
Okay.
Congestive heart failure, when you have a preserved heart muscle, is called congestive heart failure, preserved ejection fraction. It's a very difficult disease to address, and it's very common in African Americans. Then you have heart failure with a weak heart muscle, and it's more common in non-African Americans. Interesting, that pathophysiology. Again, the damaged heart muscle is related often to coronary artery disease, and African Americans have less coronary artery disease causing their congestive heart failure issues.
And more from high blood pressure.
But it speaks more for high blood pressure, more for addressable issues. Addressable issues that contribute to congestive heart failure is severe hypertension, chronic kidney disease, diabetes. These are all issues that we take for granted as young people in their 20s and 30s. We don't really address it, and then we find out in our 40s and 50s we have some end-stage organ damage related to high blood pressure that could have been addressed earlier on. Also, African Americans have something called resistant hypertension. Very difficult to control hypertension. They're not just on 1 or 2 medicines, sometimes 3, 4, 5 medicines to address
so
hypertension.
more of a stubborn, it won't move, it won't budge to the normal level.
Exactly.
Okay?
It takes multiple medicines to address high blood pressure in the African American patient compared to the white patient. It's not clear why, but it's related to, they think, to renin. Renin is an enzyme produced by the kidneys that helps drive down high blood pressure. But African Americans have a low renin state.
Why?
That's an interesting question that's not known. But renin affects the way the body vasodilates or opens up its arteries. With less renin, you have more constriction of arteries, more obstruction to flow, more inefficiency of the kidneys to do their job. So low renin states and high salt sensitivity drives high blood pressure. High salt sensitivity is something we found in our diets. In Hispanics and African American diets, we have what's called the Southern diet.
Yes.
Good food, great food that I love since I moved to Kentucky area.
Right.
But not good for us for the long term.
Okay, okay. Whew, that's a lot. That is a lot.
It's a lot, but it's addressable, thank goodness. It's a shame that we don't get on it, we don't emphasize enough. The crucial years of the 20 to 30, 40-year-old young man, let's get his blood pressure addressed. If we do, then we avoid the downstream consequences of kidney disease and congestive heart failure.
Okay.
And
so you have some statistics that you want to show.
Not only that, I have some life expectancy statistics.
Okay.
This bottom line, life expectancy is about 71.5 years. So the average person on this line lives to 71.5 years. The average person on the top line lives to 84.3 years. That's a swing of 13 years on average. And this is recent data from 2017. This bottom line is non-Hispanic black male. This top line is Hispanic female. So people have genetic predispositions and cultural predispositions to different kinds of mortality. Black male, white male, non-Hispanic black female, Hispanic male, non-Hispanic white female. So black female and black male have the lowest of their genders life expectancy.
Okay, okay.
Really interesting.
That is very interesting.
Right, how they can split out the information.
Wow. So we're not living as long as others.
Right.
So our longevity is being shortened, basically.
Shortened.
Yeah.
For addressable issues such as hypertension. Here they speak of the Southern diet, high in sodium, sugar, and fats.
Okay, okay.
Good food, but bad for us, unfortunately.
Right.
Blacks also have an increased incidence of amyloid disease, also one of the other causes of congestive heart failure that kind of goes unrecognized.
Is that, so the amyloid disease, is that genetic?
Yes,
is that a genetic predisposition? Okay, okay.
And of course the black community is heterogeneous. It's not just one black
Right.
patient. People come from the islands, people come from Africa many years ago, many generations ago. People come from other parts, like the southern part of the United States might be different than the northern part, so different family heritage, so it can't be lumped together. But there's an approximation, and they clearly have outlined differences in longevity.
Now, when it also, isn't there some issues when it comes to just the environment?
Yes, ma'am.
Okay.
And this Venn diagram tells us that.
Okay.
The first thing they speak about is the DASH diet. A DASH diet is a healthy diet, which I wish I could follow, but we should follow. Vegetables and fruits.
Lots of fruits and vegetables, yes.
Protein sources that include low dairy foods, fruits and vegetables. So that's a DASH diet. The important thing about that is not just some fad diet. The DASH diet's been around for many years and has proven itself. It is the only non-pharmacological intervention with results comparable to that of medicines.
Okay. So what you're saying basically is that that's the one thing that you can do outside of taking medication that has shown results when it comes to bringing down blood
Yes.
pressure.
Yes.
Okay. So changing the diet, changing
Mortality
what
and
we
morbidity
eat.
benefit with the DASH diet.
Okay.
I learned that in medical school many, many years ago, and it's still proven itself over and over again. This Venn diagram is very important. In the center is hypertension and cardiovascular disease. But things that contribute to that include adverse health care, higher rates of uninsured patients in the African American community, limited preventive care, less access to chronic care, and increased cardiovascular related hospitalizations.
So more social factors.
Including
into play.
suboptimal diet, increased inactivity, stress, persistent racial discrimination along the lines of healthcare.
So that's a historical
Yes,
issue.
increased poverty and economic instability. And of course the medical part, or the pathophysiology, overweight, obesity, comorbidities such as kidney disease, which is big in the African American community, high salt sensitivity, and low renin levels, what we spoke about before.
Now, from what I understand, I did do some research when it comes to infants and when you're premature. From what I understand, that also plays a role with kidneys and with poorly developed kidney functionality. So potentially that can play a role too. And we know that some portions of our population, the African American community, may have issues with getting appropriate prenatal care, and so that can lead to
Very true. Very true. I don't see those
increased
patients in my practice. We have adult patients, but of course that makes sense. In my practice, interestingly enough, I do have 20-year-olds and 30-year-olds, youngish people with very severe hypertension. I'm sure it started in their teenage years, if not earlier.
earlier. Yeah. Are you seeing more in terms of obesity, like with children? You may not see children, but are you
Young
seeing
adults
some of
with
that? Young
hypertension
adults.
often associated with obesity.
Okay.
It's just our society. We're becoming less active, more
Yeah.
sedentary.
So what kinds of things do you, as a cardiologist, what kinds of things do you advise your patients doing? I know we talked about, just changing the diet and maybe trying more of the DASH diet, more fruits and vegetables.
Yes.
What other things do you recommend?
I always tell patients stop smoking.
Okay.
It's not listed in any of this as far as congestive heart failure, but it's involved in ischemic heart disease.
Okay.
So we have to stop smoking.
So the tobacco, though, doesn't that increase your blood pressure? The nicotine constricts your blood vessels, so that's going to increase your blood pressure?
It
as
should,
well?
or rather
Okay.
it should. It could, and it probably does, but there's not a lot of science on that.
Okay.
But
So
those
stop
cause
smoking.
Yes, but those cause other issues too. Of course, stop smoking. Of course, exercise more, and that's easy for me to say. But actually, the exercise they ask is not really running and being crazy about it. All you just walk 3 to 4 times a week, 20 minutes a day.
Okay.
That really
That's easy to do.
Right. That really changes people's outcome. They lower their blood pressure even by 5 millimeters or 10 millimeters. Well, 10 millimeters we have, but 5 millimeters makes a big difference in people's outcome.
Okay. Now, so you alluded a little bit to just some of the racial issues and some of the stressors that we may experience. Tell me, how does that play a role when it comes to high blood pressure and particularly, congestive heart failure?
I think the stresses I see on my patients that come to the emergency, for example, if it's an African American male, oftentimes they're not insured. So they don't get their medicines. They don't get chronic care. They don't come back to an office that they can sit with the healthcare worker. Hey, what's next? What's on the horizon? What do I have to do next? They just can't show because of the financial stress for one. And they just don't show for their follow-up appointments. So they show up in emergency using that as their clinic, as their doctor to take care of them. And by then the process has already gone downstream, where they have beginning of chronic kidney disease, where they have beginning of damage to the eyes related to high blood pressure, damage to the heart, and a thickened heart from high blood pressure that could have been avoided.
So all these things are really, it's like a global effect.
Yes.
The blood vessels just affect so many different areas when it comes to just the body. So it's not just the heart, but it's the eyes, it's the kidneys, it's the brain, all of that.
Yes.
So we really need to, take a hold of this issue and this problem and, do something and do things early. So high blood pressure, a lot of times we think of it like it's in an older age group, but it really does start at a young age.
Sure does.
So you would advise people, let's see, we see adults, so starting at 18 or maybe even younger, starting to have their blood pressure checked. Would you advise that for children?
I can't speak to pediatrics, but I think young people should at least have a yearly evaluation get identified for people who might be at risk for high blood pressure, and those people should work with their primary care provider and say, hey, what can I do to not be on medicines? What can I do to avoid the pathophysiology that many of my older relatives have now? What can I do to avoid that?
Okay. And so if they do have a family history of it, they're going to be more likely to actually have high blood pressure as well.
And they're in the same cultural milieu. They have the same diet, the same sedentary lifestyle. So they get their diseases that their parents had and their grandparents had because they live in the same culture.
Okay. So one of the things, we're still in this pandemic, and one of the things that I've seen is that people who have high blood pressure are considered at a higher risk. Why is that, and how has this pandemic affected you in your practice?
The pandemic is terrible. It's also racially imbalanced, by the way. They did a nice study on the counties across the United States that are disproportionately black. 22% of U.S. counties are disproportionately black, but they account for 52% of COVID-19 cases.
Wow.
And 58% of COVID-19 mortality.
Wow.
So these are
that's
people,
and that's only 22%. Wow, 22% of
U.S.
counties
counties are disproportionately black.
Wow.
So you can picture some counties in every state. I'm sure in the poor states like Missouri, Mississippi, Louisiana.
Yep. Kentucky. Yep. Right here in the 402.
Right, in the 402. And these are patients that don't get access to health care, don't get seen early enough, aren't taught the right things to address the disease early in the process. So these patients have untreated asthma, have untreated high blood pressure, have untreated chronic kidney disease. That sets up an inflammatory process, which COVID is an inflammatory disease, which really escalates the danger for this. We have a 24-year-old African-American transplant in our hospital, great fellow. He has kidney disease. He has hypertension. What did he get with that? COVID-19.
Oh, wow.
Then with COVID-19,
and he's only 24?
With COVID-19, then he had blood clots because a very inflammatory
mark.
He was on a respirator. He's a great fellow, survived. He was just a wonderful patient, and he came back, and he's doing great. But he was a pretty sick fellow. If he wasn't 24-year-old, had he been 44 or 54 with asthma, kidney disease, and high blood pressure, he might not have survived it.
Wow.
So his strength was being young. But even a young fellow was so sick he was on a ventilator.
Yeah, that's a lot for someone young.
Yes.
Yes. And so having that kidney disease, having high blood pressure, that definitely played a role, sounds like.
And he's a diabetic.
And diabetic. Wow.
So
wow.
He had a lot of comorbidities before COVID, and he survived COVID right in the worst part of the early part of the COVID pandemic in the spring of 2020.
Okay. So what do you think helped him? Did he have advocates? Was he, it sounds like if he worked at the hospital, he may have already been maybe insured and in the system or whatnot. So what?
He had great advocacy. His pulmonologist was one of the best in the city, and she worked hard to keep him going and get him off that respirator as soon as possible. Good. He had advocates and the nursing staff. They loved that man, and they helped him out. And although he was isolated, he really wasn't isolated. People made signs and stuff, and came to his office, came to his hospital room. Everybody loves him, and he just did great because he had support. He had hospital community support.
So that speaks to how important community is, and it speaks to how important advocacy is for, even if you do have certain medical conditions, having an advocate, having other people, or even just one other person who advocates for you, who helps you, through this, through a system or through an acute issue is vitally important and can actually save your life.
And he learned the importance of managing hypertension. As a young man, he really didn't address high blood pressure. But he saw how important it was to get those numbers down, to let the heart heal itself, to let the heart be more efficient, to get the fluid off his lungs and come off the respirator.
Right.
It's a big process of many different parts of the body decompensating with COVID-19 infection.
Wow. Now, one of the things that we also mention when it comes to having high blood pressure and it not being as well controlled, we're talking about advocacy and all of that, but not having a primary care physician is going to be is actually a big problem. What would you suggest as a cardiologist that we do, to help with getting more primary care physicians and getting more people in to see their actual doctors?
That's a really important question. It's a societal question. We just don't have. There's all kinds of disparities in heart failure in African Americans. They just don't get the beginning care. They don't get the long-term care. They're kind of in the system emergently. They get tuned up. They get better, and they're out in the wild again without help. So it really is a societal question. How do you address these people to avoid the long-term consequences of resistant high blood pressure? How do you explain to patients how important it is to follow up? How important it is to adjust your diet a little bit? How important it is to avoid the beginnings of chronic kidney disease? That's what's important.
Yeah.
That's no one knows how to do that. But as you said before, off camera, there's a great program where other cardiologists are volunteering down
in our community.
in our community.
Yeah, so we were just mentioning some of the wonderful community partners that we have, like Park Duval Community Health Center has a great team of primary care physicians, nurse practitioners who are there right here in the community. There's also Norton Healthcare has different primary care physicians also in the community that are just excellent and can see people. And that is really where we want to be, is we want to start in the upstream, before you actually have some of these issues that occur. So I also have a practice called Global MD that is focused on prevention and
upstream
wellness.
care, that's so important. Upstream care is so important. Preventive care.
It
Good for you.
really is. It's all about prevention. What other ways has the pandemic affected you in terms of just what you see in the hospitals?
It was a very difficult year for everybody around the country. The risk that the emergency room doctors, the emergency room nurses, the ICU specialists put themselves under to help these patients, unbelievable.
That's a lot.
Yes, an ER doctor, without mentioning names, developed a COVID-19 infection. Thank goodness he did well. Other doctors and nurses did throughout the system that I'm involved in, and they did well for the most part. The risk they put themselves on, I just couldn't believe how they did it, and they did it. They put their own lives at stake to help these patients.
True healthcare heroes.
True healthcare heroes.
Yes, yes.
The floor nurses, the COVID-19 units, the ICU, which was a very dangerous place to be for their own health early in the pandemic. Thank goodness now, with people understanding mask mandates, people understanding the importance of vaccines, it really has taken a turn for the better in the last 2 months. It really has changed the concept of caring for patients. Now it's going to be kind of a less dangerous process. People can still get COVID-19 after you're vaccinated, but sure as heck, they don't have that inflammatory process.
Right,
they don't,
right. And it's so great that we understand it better, or we think we understand it better overall, and that we can, it's almost like we're coming out of this.
Yes.
We still need to wear our masks, we still need to be somewhat socially distant, to a certain, I shouldn't say socially, I should say physically distant to a certain degree, right. But
it's so important to still be compliant. It really is.
Absolutely.
I'm not an expert in COVID-19, but apparently there are variants that can be very dangerous, and there's still people out there who are not vaccinated for whatever reason. So it's a very dangerous situation still. But boy, they've done a great job of moving this vaccine forward, getting out to the population, getting it to people that are stuck at home.
Yes.
So all around the country, they're now putting people are homebound who can't get to the clinic to get a vaccine. They're getting it there, and those people are most vulnerable.
They are very vulnerable. So I think that there's some wonderful, innovative ideas that are going around about mobile units going around and being able to vaccinate. So looking forward to that.
So that's a form of preventive care.
Absolutely.
What you believe in strong, and I believe in also.
Yes.
Preventive care.
Yes. An ounce of prevention beats a pound of cure.
Yes.
I know that's a cliche, but it is so very true. So if we can just kind of talk a little bit more about just congestive heart failure, because we see that's one of the most common diagnoses that we see with hospitalized patients.
Right.
And so controlling blood pressure is important. What are some of the other things that we need to do to prevent, going into congestive heart failure? And then also, when we're in it, what kinds of things do we need to watch out for?
Good question. Congestive heart failure has many different causes of congestive heart failure. If there's a structural heart problem, like a valve that doesn't work right.
Like your mitral valve, aortic valve.
Like the mitral valve may leak too much.
Okay.
The aortic valve may leak too much, or the aortic valve may be stuck. If you can fix the structural processes that cause congestive heart failure, that's important.
Okay.
But the more common form of high blood pressure in African Americans is just high blood pressure, and result in thickness of the heart. It makes the heart less efficient in doing its job. There's two parts of the heart cycle. There's the emptying part and there's a filling out part. For African Americans in a thickened heart, the filling out part is harder on the heart. It just doesn't do its job very efficiently, so fluid backs up in the lungs, and people get very short of breath. As you get more and more short of breath, you start restricting your lifestyle, you start seeing other processes downriver, like kidney damage, because the blood is not blood is not doing a good, I'm sorry, the heart's not doing a good job processing blood, and the kidneys start to struggle. And there you go, they're in a cycle now of the kidneys and the heart not working right, driving high blood pressure, making the heart work harder, making more fluid buildup, making edema that you see very clearly.
Swelling, right.
All that is kind of the cycle of congestive heart failure.
So it's just a circle, really, literally. What does, now, more people have been diagnosed with sleep apnea.
Also associated with sleep apnea. Sleep apnea is associated with right-sided heart failure.
Okay.
If you have somebody that has a lot of swelling and they have a good, strong heart muscle, but yet they have sleep apnea, it's a very common association, sleep apnea and right-sided heart failure. The heart chambers are left and right chambers. Right really processes blood to the lungs. When the lungs aren't doing a good job from issues such as sleep apnea, there's backup pressure to the right chamber or the right ventricle.
So you have both sides.
Yes, and then you get fluid buildup to your legs and your belly from right side failure. The most common reason for right side failure is left side failure, but along with those other causes such as obstructive sleep apnea. So I want to backtrack a little bit. Black patients have the highest incidence and prevalence of heart failure, as well as the worst outcomes.
Wow.
It's expected to affect almost 3% of Americans by the year 2030, but blacks will carry a higher percentage, up to 3.6%. So those are big numbers that are preventable.
Yes.
Especially since blacks have worse outcomes.
Yes, absolutely. And so that's one of the goals of this show, is to work upstream, but even if we're downstream, to do whatever we can to prevent these issues and really help with the longevity of our lives and also the quality of our lives.
Yes. Prevent by addressing high blood pressure, which is increasingly deadly for black people. There's a nearly twofold higher mortality than their white counterparts for high blood pressure related issues.
Okay.
It seems like people who are insured, black or white, have a better chance of addressing these processes early.
So having insurance is important. Okay. What do you think about just universal insurance coverage?
I think it's appropriate.
Okay.
Yeah. I don't know enough about it. I don't know the politics behind it. But it seems to me if you get everybody under care, that they can go to their clinic, they can go to their primary care doctor, they can work with their nurses.
Right.
They can get things done early on, then avoids the big cost down the road of people going into kidney failure, needing dialysis, people not addressing their diabetes early, losing their vision, losing their kidneys, getting heart disease. All that, if you get it upstream and fix it with, if it takes universal care, let's do it. I don't know enough about the politics of it or the cost of it, but I understand the logic of it.
Right. And we talked a little bit about stress and just how stress, plays a role. This last year, when it comes to the pandemic, when it comes to the issues that have been going on in terms of racial injustice that have been highlighted. They've been going on for many years, but they've really been highlighted over the last year.
Yes, they
And then
have.
also with the political, turmoil and unrest that has been going on, there's just a lot of, it seems like mental, stressors.
Yes.
So are there things that you would advise that would help, with all of these things going on? It's like, it feels like it's just a perfect storm of of people, having increased blood pressure and then going into these downstream kind of issues. Are there other things, we've talked about changing your diet. We've talked about, getting that exercise. We've talked about, seeing your doctor, but what kinds of things can people do even in their, just in their homes to reduce their stressors?
Stresses are difficult to address depending on what the stresses are. People have family stress, have work stress, have financial stress. Boy, it's really hard to have an easy answer for that. One thing I do see though, if you're compliant with medicines to address high blood pressure and get that goal going, lowering your blood pressure, inspire the stress around you, kind of understand how important it is to, hey, even though I'm going through an issue at work, an issue with family issues, I have to address my blood pressure, understand that things that I can do to get my blood pressure down, and most of all, compliance with medicine.
Right.
Although medicines are difficult, medicines have side effects. One side effect of most of these medicines, we live longer and live better. You just have to be kind of proactive and get that done.
So that's a side effect of the medicine. You live
living
longer.
longer,
Wow.
yes.
Okay. But
Beta blockers make us live longer.
Yeah.
Angiotensin receptor blockers make us live longer. ACE make us live longer. So other medicines also lower blood pressure, do a good job.
Okay.
Water pills, especially effective in African Americans,
Yes.
along with calcium channel blockers to
yes.
lower blood pressure.
Yes.
There's a medicine called hydralazine with nitroglycerin, long-acting nitrogen called Imdor, helps African Americans deal with congestive heart failure and hypertension.
Wow. So those are medications specifically that have been studied in African American populations that helps with congestive heart failure.
Yes, and therefore helps mortality. The combination of hydrozine and isostar have been around for many years. They decided to study specifically an African American population, and they found it worked so well they made a pill that was combining both those agents together. To me, that's a little bit expensive. I just take the separate pills, a pill separately, and do the same thing. But the idea is that they researched it specifically in the African American community with benefits.
Awesome.
Yes.
That's just the opposite of some of the things that we've heard, like we're not in those studies, we're not getting the care that we need. But these are medications that people probably need to talk with their doctor about, but that can really help to, treat congestive heart failure, specifically in African Americans.
And African Americans are excluded, seemed like, from major studies for downstream severe cardiomyopathy, weak heart muscle leads to heart failure. You don't hear too many African Americans going through transplants. They have a harder time surviving that. They have a harder time with that. And you don't hear African Americans going through a left ventricular assist device process either. These are LVADs. These are costly systems to help people live longer. And you just don't see African Americans in that stream. Why? They don't have insurance to get there. They just don't. So they seem to be excluded from getting it, and they're also excluded in the studies. They're trying to address that.
Okay. All right. One last thing. We always talk about things on the Healthy Mind, Body, and Spirit, but we also want to be about it. What kinds of things do you do, Dr. Ortiz, where you are not just talking about it, but you're being about it?
Well, I love this area where we live. I love that bridge.
Okay.
I always walk that bridge. I see my patients on that bridge. I promise them a root beer. If I see my own patients again, I say, I'll buy you a root beer at the end of the bridge to get them. So that's very
The bridge
important.
that crosses between Indiana and Kentucky.
Yes,
so
that's a great
awesome.
idea.
It is.
It's no car traffic, no hassles. It's easy place to exercise at your pace and be comfortable. Plus, it's a beautiful sight.
So it's exercise and relaxation. So that sounds like a great thing.
A great
to help.
stress reliever too.
Great stress reliever, yes. So thank you so much, Dr. Ortiz.
Well,
you have been a wonderful source of information for us here on the Healthy Mind, Body, and Spirit, where we focus on healthy lifestyles, wellness for all, with a particular focus on the African American community. Thank you for joining us.
Thank you for having me.
Truth, justice, power. It's TV our way.